Hello, this is Dr. David Green, CEO of the New Jersey Pain Network. Today's topic is the top 10 ways to avoid the need for a joint replacement. Over 1 million joint replacements are performed every year in the U.S. Hospital stays typically entail 2 to 4 days. For knees, the average age is 70 years, 60% are women. The infection rate is low, but it's still 1 to 2%. There's a risk of blood clots. The overall satisfaction for the procedure is very high, and most still work after 20 years. Having said that, it's not a risk-free proposition. Now, these are a quality of life procedure. No one has to have a joint replacement. Because they don't last forever, it's advisable to wait as long as possible to undergo the procedure. The implants themselves for whatever area of the body are made of titanium, cobalt chrome, stainless steel, ceramic material, and polyethylene, or a combination of those materials. So treatment option number 1 to avoid a joint replacement is activity avoidance. If it hurts, don't do it, or do it less. So if you've been running 4 or 5 days a week and it's killing your knees, switch over to cross-training a couple days a week. Maybe do some swimming, some cycling. Additionally, a cane or a brace, depending on what area of the body is arthritic, can be very, very helpful. For instance, a cane can take 50% off of an arthritic hip or knee. Treatment option number 2 consists of over-the-counter medications. This may include anti-inflammatories, Tylenol, glucosamine, and chondroitin are available over-the-counter. They're called nutraceuticals. Prescription medications may include topical prescription pain creams, higher doses of NSAIDs, Celebrex, and short-term opiates for acute exacerbations. Long-term opiates for arthritis is not a very good idea. Treatment option number 4 includes TENS units. These are battery-powered, about the size of an iPod. They fit on one's belt. They provide low-dose electrical stimulation through the arthritic joint with these foam pads that go over the area of pain. They can change the way the brain perceives pain signals. Treatment option number 5 includes weight loss. Less joint stress means less potential damage to weight-bearing joints. Losing weight with exercise may strengthen up the muscles around the arthritic joint, lessening pain. Number 6 is physical therapy. Strengthening muscles around the joints, as mentioned, can take pressure off the joint and lessen pain. Modalities including ultrasound, electrical stimulation, these can help decrease pain along with stretching. Number 7 is acupuncture. There have been several studies looking at acupuncture for arthritic joints, and universally, those studies show significant benefit. It's a very low-risk treatment. It's outpatient, takes less than an hour, and it can provide pain relief for weeks to months. Number 8 is steroid injections. These have been a gold standard for the treatment of arthritis. It's never been proven that steroids damage joint cartilage. This is thrown around a lot, but it really is not been proven. They showed it in small animals years and years ago. They never showed it in large animals, and it's never been shown in humans. Typically, steroid injections are given every few months as needed. They really don't alter the disease at all. They're a proverbial Band-Aid. They can provide relief and help avoid or delay the need for joint replacement. Option 9 is hyaluronic acid injections. These are made from rooster combs, interestingly enough, and all the different varieties, including Synvisc, Hyalgan, Orthovisc. Our joints contain significant hyaluronic acid naturally. It's the motor oil of our joints. The theory behind the injections is that the hyaluronic acid itself provides pain relief, and it can promote formation of cartilage. Studies show 65% good to excellent results for 6 to 12 months. There have been some studies showing better results than that even, but they are FDA approved and insurance reimburses for when they're indicated. Treatment option number 10 involves regenerative medicine injections. These are truly cutting edge. PRP therapy stands for platelet-rich plasma therapy, and basically it's a simple blood draw with the blood being spun down in a centrifuge for about 15 minutes. And the middle layer that results has increased platelets, growth factors, and these get injected into the problem joint. It draws in your own stem cells and helps repair and regenerate. The other injections involve stem cell therapy. This may include bone marrow derived, fat derived, or from amniotic derived, and that comes from consenting donors after a scheduled C-section. All 3 of those have shown excellent results in small studies for arthritic joints, and their use continues to grow annually. The outcomes are that most patients are able to delay or avoid the need for joint replacement with the some of these or all of these options. While most joint replacements end up fine, there's always a chance of complications, and it is a quality of life procedure. No matter what kind of joint replacement you receive, it's never going to replicate what God gave you as far as the natural ability of the range of motion and ability to use that joint. Knee injections provide over 75% good to excellent results. The top non-operative pain management in New Jersey is through the New Jersey Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online at newjerseypainnetwork.com and then call us for more information and scheduling at 844-2NJ-PAIN. I'm Dr. David Green with the New Jersey Pain Network. Your pain stops here.